we'll go ahead and get started. Welcome, everyone. I'm Maria Marshall. I'm the director of the North Central Regional Center of Rural Development. We welcome you to our webinar series. It's a great webinar today addressing rural mental health in the North Central region. Just as a reminder, you can go to the next slide, Shannon. Our next webinar in December will be the changing relationship between farm and non-farm families by Stephen Deller. That'll be December 10th, 2 p.m. to 3 p.m. So right before you go to the holidays, one more learning event for you to go to before you go onto the holidays. So let me introduce our speakers. We have a great round of speakers. Our first presentation will be by Shannon Sparks from the University of Wisconsin-Madison, Division of Extension Evaluation Specialist. Sheila Michaels, University of Wisconsin-Madison, Adams County Behavioral Health Educator, and Danette Hopke, also from University of Wisconsin, Behavioral Health Outreach Program Manager. Our last speaker will be from South Dakota State University, and will be Andrea Bjornstad, Associate Professor, Extension Specialist, Mental Health, School of Education, Counseling, and Human Development from South Dakota State University. And with that, Danette, Sheila, and Shannon, the floor is yours.
That sounds great. Thank you so much, Maria, for the introduction and for welcoming us here today. Today, our team is going to share with you one of the ways that Extension in Wisconsin is supporting youth mental health in a cross-institute approach. As Maria indicated, my name is Danette Hopke, and I'm joined today by Sheila Michaels, behavioral health educator in Adams County, and our evaluation specialist, Shannon Sparks. Unable to be with us today, although noted on our first slide here, is Megan Surin, who is our positive youth development educator in Shawano County. Both Sheila and Megan were part of a team of educators that were integral in developing and implementing this program. It's also important today that I acknowledge that in the developmental stage of this program, our Wisconsin team collaborated with the Michigan State Extension team to build out tools and resources as well. Today, we'll be focusing on the Extension in Wisconsin perspective of development, implementation, and evaluation of this program. All right. Shannon, you can just skip to the next slide. That's our little transition slide. There, great, thank you. All right, so I know this slide has a lot on it. This graphic is a sneak peek behind the curtain of the Division of Extension at the University of Wisconsin-Madison. One of the things that's unique about Extension in Wisconsin and really enabled us to be well positioned to embark on this effort is that we are still deeply rooted in a county-based educator model with a shared funding contract between Wisconsin counties and UW Extension. This graphic really depicts the institutes and program areas as well as the leadership structure within our organization. Additionally, what's somewhat unique to Extension in Wisconsin is that we have created two separate institutes for the Family and Consumer Sciences areas, which include the Health and Wellbeing Institute and the Human Development and Relationships Institute, as well as structuring our Positive Youth Development Institute to contain both 4-H and community youth development program areas. Within our Health and Wellbeing Institute, we have the Behavioral Health Program area that I represent as the program manager, and Sheila represents as a county-based educator. We also have the Healthy Eating, Active Living, and the FoodWise program areas. I know that's a lot to make sense of. What it essentially boils down to is that each program area has a unique audience, unique logic models, unique expertise, as well as unique efforts. Whenever possible, we try to join forces to bring our unique areas of expertise to the table to achieve outputs and outcomes across our program areas. This Supporting Youth Mental Health program is a joint effort between our 4-H program and our behavioral health program area, with educators and leadership from both areas coming together to provide training and resources to support adult volunteers working with youth. And with that, I'm going to have to pass it to Sheila.
Thanks, Danette. So let's just take a look at the experiences of youth mental health in Wisconsin. Give me a second here. I just lost my course. Hang on. Apologies, everyone. I can't seem to get out of the mode to see my notes. And I just had it ready. So I will go from memory. So the state of youth mental health in Wisconsin. So the most recent youth risk behavior survey was completed in 2023. So we looked at that report based on the students in high school to see what are students and young people experiencing around mental health in Wisconsin. And what we learned is that more than 1 in 3 students had reported symptoms that align with depression, which is to say that they have experienced prolonged sadness for at least 2 weeks on more than half of the days of each week. And in addition to that, the levels of anxiety have also been on the rise. So the levels of depression are 10% higher now than they were 10 years ago. And then similarly, anxiety levels are also 10% higher now than they were even 5 years ago. And the levels of anxiety that students are reporting is over 50% of the students. And on top of that, only 1 out of 5 of them say that they're receiving the help they need most of the time or all of the time. At the same time, we're noticing decreases in protective factors, which is like school connectedness and belonging, also showing decreases in school safety as well as physical health. It may not be a surprise to anyone that screen use is on the rise. And then positive health indicators such as getting adequate sleep or eating breakfast are declining. And then when we look at what is often considered some of the most serious mental health conditions and situations for young people, and suicide and suicidal thoughts and non-suicidal self-harm as well, those rates are also quite high, with 1 in 5 reporting non-suicidal self-harm or injury, and 18.6% of students, that's quite staggering, reported that they had seriously considered suicide in the previous year, and 8.7% had reported attempting a suicide. And those rates go up much higher when you break that data down by population. And because I don't have my notes in front of you, I can't tell you the details of what they are, but certain populations are experiencing that at a much larger scale than what the average numbers will show. Next slide, please.
Sounds good. I can fill in just a bit of those details too, just looking
Thank you.
Yeah, no problem, Sheila. Some of the notes. So as Sheila noted, so we've got that 8.7% of students reporting a suicide attempt. That rate is much higher amongst females, which is at 24%. Individuals that identify as LGBTQIA+, a rate of 40%. Students who are food insecure, 30%. Students with low grades, 27%, and students with health conditions, 32%. So as you can see, those rates really continue to increase and are at really, as Sheila noted, just staggering rates there. We also have, I don't know, we seem to think in Wisconsin that it's a somewhat unique phenomenon, although I know that it is also present across the nation. But we have a high rate of alcohol consumption in the state of Wisconsin across the lifespan. And 26% of Wisconsin students report that they drank at least 1 drink of alcohol in the last month. And that's in comparison to the national rate of 23% as well. So those are definitely some significant data points that put our youth at risk and increase the need for us to have programming that appropriately addresses those needs and supports their well-being. So with that, Extension's Positive Youth Development Program has a variety of adults that serve in volunteer or professional roles. These adults have unique opportunities to engage youth and to create safe spaces for them. These interactions have the potential to allow youth to share their feelings, to debrief the experiences that they've had, and to understand how experiences and emotions might be affecting them. Oftentimes the adult volunteers build long-term relationships with youth, and this then increases, of course, the likelihood that there are opportunities that youth will engage and share with those adults. And likewise, where an adult may encounter a youth that's facing a mental health challenge. The current requirements for 4-H volunteers include 4 hours of training, which includes a requirement to complete training in youth mental health. To meet this requirement, the Wisconsin-Michigan 4-H program sought to equip extension volunteers with knowledge and skills to assist youth facing a mental health challenge or crisis. Beginning in January of 2022, one of 2 trainings, either youth mental health first aid or supporting youth mental health, were required courses for Wisconsin adult volunteers in chaperone roles. This requirement and both of these trainings seek to provide extension volunteers with training that helps them to understand youth mental health and their role in supporting it, to also promote safety and inclusive environments that support youth mental health, reduce stigma, and increase those help-seeking behaviors among youth, and then finally to build skills and strategies for preventing crisis situations, for building relationships, and communicating non-judgmentally with youth. So let's take a look at these 2 training options. Many of you may be familiar with the Youth Mental Health First Aid Program. It's an evidence-based training that originally was developed in Australia and was brought to the United States and adapted and supported for use in the United States by the National Council for Mental Wellbeing. This program teaches adults to identify, understand, and respond to signs of mental health and substance use challenges and crises among children and adolescents ages 12 to 18. The training is intended to build understanding of common youth mental health challenges and typical adolescent behavior. It includes a 5-step action plan to help adults identify, again, those youth who may be experiencing a mental health challenge and have the appropriate strategies to support them. The national research in the United States has found that mental health first aid increases confidence, mental health literacy, and positive attitudes toward youth mental health. And additionally, the researchers have found statistically significant improvements in participants' confidence and intentions to intervene, their preparedness to engage, and mental health literacy. Trained youth mental health first aid instructors facilitate 7.5 hours of curriculum content. And to really effectively conduct this program while adhering to the adult learning principles, it takes 8.5 to 9 hours to allow for adequate breaks, meals, and meaningful learning engagement. So while we know that this is effective for some audiences, the time commitment and the intensity of this training can also really be a limitation of this program. Feedback from early implementation of the Youth Mental Health First Aid Program with adult volunteers in Wisconsin found that there was really a need to provide a training that asked for less of a time commitment and was a less intensive in the content that was delivered. So in the fall of 2020, a team of Wisconsin and Michigan extension educators from diverse individual and professional backgrounds developed Supporting Youth Mental Health to meet this identified need. Supporting Youth Mental Health is a 2-part training. 1 hour is an online module followed by a 2-hour live training. And that live training can be presented either in person or virtually. And it's also offered through flexible training options. So we included early mornings. We had classes that started at 6 o'clock in the morning. We have evening offerings as well as evening offerings. And again, with a variety of those being in person and virtual to meet the unique personal needs of the adult volunteers that we're supporting 4-H programs in Wisconsin.
So when we developed the Supporting Youth Mental Health training, we wanted to ensure that it was relevant to what volunteers might experience in their roles. So we invited a team of experienced 4-H volunteers, as well as a number of diverse youth to provide insights and guidance. So supporting youth mental health was developed to increase knowledge and skills of 4-H adult volunteers who work with youth, specifically in an overnight chaperone role. So the training engages participants through interactive online learning, practice scenarios, and discussion where they learn about their important role in supporting youth. The steps delivered in the training to support youth mental health are to build trusting relationships with youth before and throughout the programming, to recognize the signs of a mental health challenge, to build skills in how to communicate in a non-judgmental manner with the youth about what they're experiencing. And then the training provides guidance on when and how to talk to a staff member from the 4-H volunteer standpoint about what is going on. And then the training also includes some support on how to continue that ongoing relationship with the youth. The Supporting Youth Mental Health training includes a printable reference guide that summarizes the content covered during the training, and it provides also a flow chart for decision making and includes a list of contacts and resources they can use in the moment when they're needed. And the guide also includes a worksheet for them to develop their own self-care action plan, because we know how important it is to take care of ourselves after we've been providing that level of intensive support to another. When we're delivering the Supporting Youth Mental Health program, we use a co-training model. So one of the educators is a 4-H extension educator in the Positive Youth Development Institute, and the other is an extension educator from the Health and Wellbeing Institute who specializes in behavioral health. This diversity of professional experiences in the room allows for a very responsive and engaging training.
So today we also wanted to spend some time telling you about the comparative evaluation that we did with these two youth mental health curricula. So you can go to the next slide, Shannon, thank you. After the initial pilot implementation period, we collaborated with our evaluation specialist, Shannon, to create a pilot evaluation. The goal of this evaluation was to assess the comparative effectiveness of supporting youth mental health and the youth mental health first aid programs in preparing individuals to support youth experiencing mental health challenges. Additionally, we were interested in understanding how participants had used their training since completing either of those two programs. So the methods that we embarked on were to conduct this evaluation was an online Qualtrics survey that was sent to all participants who had completed the Supporting Youth Mental Health or the Youth Mental Health First Aid training in the past 3 to 12 months. The survey was distributed in September of 2022 to 279 participants, with 99 surveys being completed, which actually resulted for us in a 35% completion rate. And with that, I'm going to turn it over to Shannon to talk about the findings.
Hey everyone. So just briefly, a little bit of what the survey contained. We were asking participants first about their beliefs about mental health problems, as well as their confidence that they felt and whether they felt they could help youth experiencing mental health challenges. We asked them how they would respond using a hypothetical scenario to a youth experiencing a mental health challenge. And then finally, we wanted to ask them how they'd use their training, as Jeanette said, since they had completed the training, and if they felt they had enough support or information to effectively intervene with a youth that might be experiencing a mental health challenge. So I'll talk a little bit about the findings from the evaluation. I'm not going to go super in depth. We will actually at the end drop a link into the article that we've published from this if you want to get a little bit more in depth. So first of all, in relation to the questions about beliefs about youth mental health, respondents were asked the extent to which they agreed with a series of statements on youth mental health beliefs. So some examples of this were some of these statements included mental health problems are a sign of personal weakness. A second example is, I believe I can do something to help a young person with a mental health challenge. So basically, what we found during our analysis is there were no significant difference in these beliefs between those who had completed the Supporting Youth Mental Health training and the Youth Mental Health First Aid training. Next, we looked at the questions that looked at changes in confidence and behavior. So we asked participants how likely they were to help a young person experiencing a mental health challenge, as well as how confident they felt they would be in helping. And so we looked for changes in confidence and behavior from before to after the training using a retrospective pre-post design for these questions. So what we found here is that both participants from Youth Mental Health First Aid and Supporting Youth Mental Health found significant increases in confidence and likelihood to take action after completing the training. We did see that Youth Mental Health First Aid had greater increases, but this difference was only statistically significant for one of these items. So next, we looked at use of mental health training. So there were really no significant differences between participants of these two trainings in terms of how many of them had used the training in the last 6 months. It was approximately 60% for both. And we got some really good quotes from participants kind of talking about how they'd used this training. So here's just a few. One commented, in general, the youth mental health training has made me more open and a better parent, school employee, and leader. Another commented, I have learned to listen. It's not always necessary to have an answer, but to be a sounding board for the youth. Here was another comment. I've been able to notice smaller changes as a sign of needing help versus thinking that they are just having an off day. And a final example, I noticed some changes in mood/behavior and asked some open-ended questions, and then asked the youth if they were willing to talk to a person that was trained on how to help people navigate those situations, and he agreed. So finally, we wanted to see if participants felt they had enough information based on the training to intervene with a youth experiencing a mental health challenge, and if they felt they had enough support or they needed additional support. So we looked at this on a scale of 0 to 10, 0 being I need a lot more information or support, to 10 being I have all the information or support I need. So the average score was 7.5. Once again, there was no significant differences between participants of the two trainings on this scale. And in terms of where they did note that they needed additional support or training, here were some common themes. Several noted that they wanted more practice or experience so that they could have more confidence in engaging youth around their youth mental health challenges. Several commented that it would be really nice to have an additional training or a refresher course. There were also some requests for more community resources or referral options, particularly maybe options for area professionals with appropriate training or qualifications. And then there were some requests for additional tools or quick reference materials that could be used. So finally, just in summary, as a result, and once again, we want to emphasize this was really a pilot investigation. But after looking at the results, we saw that participants from both trainings saw significant increases in confidence in helping a youth and likelihood to take action. And that participants of both trainings felt similarly prepared to support youth in terms of information and support, but both expressed desires for additional training, experiences, and resources. So based on this, supporting youth mental health appears to be an acceptable training program to prepare adult volunteers to support youth mental health. And I will turn it back to Danette.
Great, thanks, Shannon. So I did just drop into the chat the link to the article that we were able to publish after a long writing and revision process. We were honored to have our article published in the Journal of Youth Development this summer. This slide really highlights all of the extension professionals that contributed to that article. And again, feel free to go to that link and read all about our details in much greater depth than we were able to present today. That concludes our presentation, and I think we are right on time today. So thank you all for joining us. And We'll be on at the end for questions if anyone has them.
Perfect. Thank you, ladies. Our next presenter will be Andrea. And again, we'll take questions at the end, but you can start putting some in the chat if you would like as well. We'll make sure if it doesn't get answers, we catch up with it.
Hi, everyone. What a great program that they developed and tested out in Wisconsin. And so I'm transitioning a little bit from the youth side to more of the adult side, especially in rural mental health, focusing on farmers and ranchers here in South Dakota. So within the past couple of years, I've conducted a needs assessment on farm stress and mental health. And so I'm only presenting preliminary findings today. The qualitative report is completed, but we're still working on the quantitative aspect. So I'm only presenting descriptive statistics related to the quantitative side today. The project was funded by a USDA NIFA grant, and it is with the North Central Farm and Ranch Trust Assistance Network. So I've been privileged to be able to do this work here in South Dakota. I had been doing a lot of programming as the mental health specialist in SDSU Extension, and I decided to take a step back and conduct a very thorough, comprehensive needs assessment on farm stress and mental health to give me an idea of where we should go next in South Dakota with programming. So I will start by talking about the survey that I used for the needs assessment, and then as well as the qualitative side with the focus groups and key informant interviews. My team is listed here. It was very interesting. Most of my team consisted of graduate assistants and interns. My statistician is an associate professor at South Dakota State University. I'm privileged to work with him. So what we did is we developed a survey and purchased a mailing list of farmers and ranchers, and it was 10,000 names. We mailed out all 10,000, which was a lengthy process, and about 1,000 came back as a poor address or a note saying the producer had passed away, or maybe they weren't farming and ranching anymore. So we sent out 2 surveys, one for the producer and one for the spouse, if applicable. And our final sample size was 2,118 after we cleaned up all the data. So this includes all of the people that completed all of the assessments. So there weren't any missing data. The average age was 62. In South Dakota, the average age of a farmer and rancher is 57.2. So we did have an older sample. I had some farmers and ranchers in their 90s sending the survey back who were still engaging in farming and ranching. So I think that's important for us to think about when we're working with producers, that some of them maybe economically cannot, financially cannot stop farming or ranching, or maybe they don't want to. I'm very excited about this. My sample, 60% were males, 40% were females. So I have a close as far as sample size goes to make comparisons as I move forward with the data. 86% were married. The race doesn't surprise me here in South Dakota. Religious practice, as you can see, most were very religious or somewhat religious. And I had a nice normal distribution of education with, as you can see from the table. I am also excited 14% served in the military, and I also do research with the military, so I'll pull out that sample and be able to analyze them a little separately. Role in the operation, 49% reported they were primary operators and 26% reported partner operators. If you look back, 40% of my sample were females. Of those 40%, 21% reported just a spouse role. The other percent, I reported either a primary or partner operator. Percent income from farming or ranching, as you can see, a good majority has most of their income coming from farming and ranching, with 25% at 50 to 74% income, and then 39% reporting 75 to 100%. Primary commodity, row crops and beef, which doesn't surprise me based on past surveys I've sent out in South Dakota. Operation size, I did not limit the survey based on number of acres, so we did send them to smaller farms and ranches. The average size here was 1342. In South Dakota, the average size is 1495. So we're not too far off on average size. Operation type, 48% were reported family operation, 52% were independent, which I find interesting because the statistics in South Dakota show 81% of South Dakota farms are family farms. I did have a lot of people say they were third, fourth generation producers, but they were independent. So maybe they purchased land, or maybe they inherited the land, or now are operating it independently. So one of the first assessments I used was the PHQ-9, which measures depression, and I only sorted it by gender at this point. I did do a quick look at age. Keep in mind, I have not run any analysis on if there are significant differences between males and females, but I had 22% of males report mild to severe depressive symptoms and 19% of females. In a previous survey I used in 2017, I used the major depression inventory with 172 farmers, and that was 8.7% back in 2017. So you can see that has jumped. However, in a regional study I conducted with 4 other states, we had a 28.7% reported those mild to severe depressive symptoms. So you can see where I'm comfortable with these percentages. I think that it's measuring it pretty close to what I would estimate here in South Dakota with the PHQ-9. I used the GAD-7 to measure anxiety. I had 30% of males report mild to severe anxiety symptoms, and females 28%. Typically, if we look at the literature, females tend to report higher symptoms of anxiety than males. So this does give me some understanding of maybe some areas to work with my with male farmers and ranchers here in South Dakota, trying to focus on how do we decrease some of these anxiety symptoms. The suicide behavior questionnaire revised. I've used this in the past with different surveys as well. As you can see, those that are at risk, females actually reported a higher percent reported at-risk suicide behaviors than males. So 3.5% to 2.5%. Again, in a regional study that I led in 2019, 7.6% were at risk for suicide. And what we're seeing in South Dakota is we've actually seen a decline in suicide. So in 2021, we had 202 suicides, and in 2023, we had 180. So I know the state, I serve on different statewide teams that are focusing on decreasing suicide. So I know that there are a lot of initiatives happening. I've been traveling South Dakota, talking to producers on how do we manage stress, anxiety, depression, those sorts of things. So hopefully this is demonstrating that we're having some kind of impact in South Dakota. This is the first time I've assessed alcohol use with farmers and ranchers in South Dakota. As you can see, 30% of males reported at risk, and the audit C measures hazardous drinkers or active alcohol use disorders. 30% of males and 27% of females. I pulled up some statistics from the South Dakota State Epidemiological Outcomes Behavioral Health Indicators Executive Summary. That is a mouthful. And in 2018 and 2019, this is the most recent I could find, 6.36% of adults had an alcohol use disorder in South Dakota. So as you can see, the percentage is much higher in this sample than what had been reported in adults in South Dakota based on this executive summary. I also looked at opioid dependence using the rods, and 5.5% of males and 3% of females were at risk. Again, with that executive summary, in 2018 and 2019, pain reliever misuse among adults was 3.7%. I also used the brief cope to look at different coping behaviors, and I've used this in the past. to see what kind of coping behaviors are related to depression, anxiety, and suicide risk. And Dr. Courtney Cuthbertson and I published an article that demonstrated that self-blame was the only risk factor for suicide risk in a regional sample of producers. So I wanted to replicate it and see if the sample demonstrates the same thing. So I know that this really doesn't say anything. If you look, the highest appears to be emotion-focused coping. And emotion-focused coping has some positive behaviors as well as some maladaptive behaviors. So really, I'm going to have to pull out which ones are most related to depression, anxiety, and suicide risk. I know I'm cruising right now. I apologize. I did ask about health conditions. So have you ever been told by a healthcare provider that you have any of the following health conditions? I highlighted the top 4 in every category. As you can see for males, the top is hypertension, followed by high cholesterol, arthritis, and heart disease. I asked the South Dakota Department of Health colleagues what their thoughts were. They weren't surprised except for the heart disease. They were surprised by that percentage. Females, again, hypertension, high cholesterol, arthritis, and obesity was the different one there. And in the overall sample, it's very similar to females: hypertension, high cholesterol, arthritis, and obesity. So again, really thinking about what can we do in South Dakota to work on. I mean, these are just the people that have been told by a healthcare provider that they have these conditions. What about the producers who haven't seen a doctor, who probably struggle with some of these health conditions? So that was a quick overview of the survey that was sent out. As far as the needs assessment, we also conducted focus groups and team formant interviews, and I had a different team for that. We actually started with the qualitative part of the assessment first, and I'm grateful for Dr. Florence Bacot, who led the qualitative data analysis. The report is finished. She put together a phenomenal team that analyzed all the different types of qualitative data that I collected. I started off with an advisory board of agricultural leaders across South Dakota. So as you can see, I had buy-in from numerous organizations ranging from wheat, soybean stock growers, beef, pork, soil health, had buy-in from the South Dakota Department of Agriculture and Natural Resources. So a great advisory board that helped develop 5 overarching goals for the focus groups and key informant interviews. Really, we wanted to gather baseline data on mental health concerns on the farm family, explore communication channels, what types of programs are they likely to attend, what topics are of interest, explore how farm families seek solutions or identify options to financial stress, how they prepare for weather extremes, and then perceptions of mental health and barriers to seeking treatment. I'm very proud of what the team accomplished. We had 37 key informant interviews, 20 males and 16 females. Different people that we interviewed, ranging from ad leaders to clergy, state legislators, mental health professionals, agribusiness professionals. Very similar with our focus groups. We had 29 focus groups with 132 participants, and we tried again to get perspectives from multiple people regarding what was happening in agriculture. And the data analysis team conducted a directed content analysis with 6 coders. The qualitative report is actually quite lengthy. I just pulled out some of the common themes, starting with stressors connected to agriculture. And a lot of these won't be a surprise to most of you, I'm guessing. Here in South Dakota, we lack accessible and affordable land. If you didn't inherit the land at this point, young producers it's virtually impossible to start farming. And we also have rising input costs. That's not just a South Dakota issue. That's across, agriculture in general. We had people talking about trade markets, tariffs, political landscapes, and their impact on income. Someone quoted, "You have to be aware of so many more variables. If you get rain in South America, you have to worry about that." So determining what's happening internationally in agriculture. And finally, weather and its effect on commodity produced, work schedule, and income. Here in South Dakota, we are very, very dry. It's a very big concern moving forward with farming and ranching. I just had a radio interview with a man in agriculture who leads a serious radio show. And he was talking about how his dad always said they'd be okay if there was some moisture in the ground. And right now he said there isn't any moisture in the ground. We did get some rain last week, but I'm not sure how much of an impact that had. Unpredictable and long working hours. My kids are graduating college. I'm having to make changes now for my wife and me to be able to handle the operation compared to 5 years ago. We could fence and get it done. And now it's like, no, how do I get it done? So children transitioning, maybe difficulties hiring workers to work those unpredictable and long hours. We know agriculture is a dangerous occupation, so those dangerous working conditions and then lack of social services in rural communities is a concern in South Dakota. As far as impacting the household, we do know that there is a big overlap between the individual's identity, the farmer's identity, their business, and their family farm. A lot of them talked about equity among family members, and there's tension and resistance to change. So maybe grandpa likes to farm a certain way, dad has a say, some of the children have a say, and they're all kind of fighting over what works and what doesn't work. The younger generation are learning new practices in agriculture and want to implement some of it. And so that tension happens. But a lot of them talked about inheritance and how to make that equal. Concerns over children's well-being. My daughter, who's 23, and she's going to take over the ranch. How do we ensure that she will be able to continue to do this? And lack of inheritor on the farm. They're actually very related because I do hear a lot about my child doesn't want to take over the farm. I don't have any children that want to take it over because financially it's so unstable. They want to do something different with their lives. So children experienced and they reflected on guilt that they would be the family member to end the family legacy. Again, impacting the household, farm over family matters, that perception, parents trickle down stress to the children. My colleagues just talked about youth mental health. We do know that children can feel our stress as parents, and especially if we're not talking about our stress, our kids have to guess what stress we're experiencing. So again, if tension is high in the family, stress is happening, maybe mom is in charge of the family books and finances are off, children feel all this. Lack of off-farm activities, family members were often discouraged from participating in farm activities, or these activities took a backseat to farm chores. I have friends who grew up in agriculture that still reflect upon the bitterness they felt when everybody else went to football practice and they couldn't. Strained relationships, especially if there was not enough help for chores. So a lot of families reflecting on these things. Again, I have other key themes. I'm just presenting some of them for you here today. This is kind of a graph of based on age on what everybody was reflecting on. At the top are those agricultural stressors that are being experienced that I mentioned at the beginning. And the younger generation is really feeling pressure to take on the farm and keep the business going. A lot of them talked about holding off-farm jobs in order to even make even. Children's ages and its intersection with business and weight of providing for the family, increasing costs to survive as a farmer, aging and changing abilities on the farm. And the older generation talked a lot about, well, how do we balance that loss of family members, trying to take care of maybe mom and dad while also farming with the middle-aged parents, increased experience in assets less than short-term concerns. So I conducted several of the focus groups, and the older farmers talked a lot about regret. They regretted not going to their kids' activities and how the farm always came first. They regretted that. They also had regret over not giving everything over to God sooner, so that religious aspect. And they also had a sense of regret about not quitting drinking alcohol sooner. So a lot of those things that were high in my quantitative survey are being reflected in these focus groups as regret with the older generation. Factors shaping coping strategies, perception and stigma. It's more acceptable to talk about mental health with the younger generation. But what was really neat about these focus groups, you guys, is that I would get these farmers together and they wouldn't stop talking. Like, they really actually enjoyed the focus groups, and they reflected on, man, I wish we would do this more often. I wish we would talk about our stress more often, because I'm hearing so and so say this and so say that, and I'm feeling it too. Awareness, healthcare access, cost, and acceptability. None of this is new. Family and friends shape how we talk about mental health, and if we talk about mental health, as well as the community. So thinking about next steps in South Dakota based on the focus groups and key informant interviews, again, access to healthcare providers and services. Pretty much every single county in South Dakota has a shortage of behavioral health providers. We also know that healthcare costs are high, and that oftentimes producers and their families will let go of the health insurance first. So increasing access via telehealth, that improves somewhat during COVID. Improve availability of mental health services in rural areas by allowing providers to travel to farmers' homes, thinking outside the box. How do we meet them where they're at? Train providers who come from an agricultural background and have relevant life experience. I've actually focused on that with some other grant funding. I offered agriculture training to mental health providers in South Dakota, and we had farmer panels, we had extension panels, and these mental health providers walked away. They didn't know that a producer could lose thousands of dollars with one decision. They had no idea. Or I had two people in the panel who were late because they were chasing a baby calf back into a field. And I was looking at my watch like, oh, and so they were able to reflect, this is reality. We miss church because this happens. We miss school activities because this happens. So training and support for service providers and the larger community. We want to train service providers about communication techniques and resources, fund their training, make it a priority by management, offer support to service providers who themselves experience stress due to proximity to agricultural sectors. We do know our agribusiness professionals are pretty stressed with having to give certain types of information. Maybe they can't help producers anymore. So we know that they're stressed. Train community members as well as healthcare providers about mental health resources, as well as the nuances of working with farm communities. Collaborative programming that employs grassroots style idea sourcing, so create spaces where communities can build the types of programs they would like to see. Launch farmer to farmer and peer mentoring programs that strengthen community relationships and remind farmers that they are not alone. Again, those groups were so powerful. I did not hold, I facilitated all the women in ag groups, and there was not one group where the women were not crying, talking about their worries and stress. So I think more group work would be powerful. I know some states have launched some peer mentoring programs. I'd love to hear more about that. And if anyone's willing to share. And collaborate with community partners and organizations to co-host mental health programs on topics, maybe beyond mental health. Maybe we can focus some on those physical health indicators that we talked about earlier and tie them both together. Finally, holistic and diverse approach to outreach. Streamline and integrate currently available but difficult to reach resources. Disseminate messaging that is diverse in content and in delivery method. And contact farmers consistently with high quality communication relevant to their lived experiences. Lots of producers reflected that if they aren't part of an ag organization, they do not receive information regarding resources and programming. So that is a limitation here in South Dakota. How do we reach those producers who are not part of an ag organization with with some help that we can provide. So that kind of summarizes it all. If you guys have any questions regarding the needs assessment, again, the survey is just descriptive statistics at this point. But I'm happy to reflect more if needed. Thank you.
Thank you, Andrea. And all of you, that was a really interesting webinar. We have time for questions. So if you have questions, you can put them in the chat. You can always raise your hand. I think we're a little bit too many for just everybody to unmute at once. But you can raise your hand or put some in the chat. Oh, question for Andrea. What was the tool you used for measuring coping?
It was the brief cope.
And there was a question earlier about the SYMH, and of course now I can't remember the short version, right, of that, and whether it's going to be available. Do you have a time limit when you might make it available for others to be able to use?
That's a great question. We get every time we talk about this program, we get asked that question. And yes, supporting youth mental health. Thank you. And we do not have a timeline in place yet. We are looking at doing some additional evaluation, and then really it's a capacity piece on our end. In order to be able to disseminate it, we have to be able to support that training and development in those pieces too. So we are not in that space yet, and but stay tuned, maybe someday.
Well, definitely, I would say touting one of the NCRCRD's grants, that we have a $5,000 Train the Trainer grant. So when you are ready to do some Train the Trainer, you can always apply, or others can apply to have you come down and train them on this program. And we accept those on a rolling basis. So I'll put a plug in for the RFP while we're talking.
That's fabulous. Thanks, Maria. That fits well there. I do see a question that came in. How easy is it to take the youth mental health first aid training? So we offer youth mental health. So the behavioral health program area in Wisconsin Extension supports the mental health first aid programming in as a part of our work. There's other groups and organizations that bring the program out, but we have funding and a model to support that delivery across the state of Wisconsin. And so really it's a matter of finding a mental health first aid course and having the time available to commit to it. As we noted, it takes a minimum of 8 hours to complete a training, and it's often slightly longer than that because there's 7.5 hours of content. There's a few different delivery models that can take place with mental health first aid trainings. But you can go to the National Council for Mental Wellbeing, their website, and they will have access to trainings that are available and that have been published around the nation. Oh, there we go. Fantastic. Jennifer put AgriSafe often offers them free. So fantastic. And I was just going to say, and here in Wisconsin, we are currently meeting our local need and local demand and request for also organizations and agencies across the state is really maxing out our capacity to deliver statewide offerings. But eventually we hope to be able to offer statewide offerings that are open to the general public. But right now our local requests and those business and organizational requests are kind of filling our capacity right now.
This is a question comment for Andrea. I was reading a few articles, I don't know when it was, I blinked, so it must have been last year or this year, but talking about suicide in rural communities. And so I was surprised to see that women had in your survey slightly higher than men, because usually men have a higher incidence of suicide than women in rural communities.
Yes, absolutely. And in South Dakota, it's very similar. Males are our main concern, especially within the 20 to 29-year-old age group and the 40 to 49-year-old age group. So I was surprised too. However, and I don't know which researcher, I read an article where a researcher hypothesized, I'd have to pull out the research. So forgive me, everyone. I'm just kind of saying this without knowing the citation, but a researcher hypothesized that maybe producers go through the suicide pathway faster. And I actually discussed this at a suicide prevention conference with those that worked in suicide across the state. And they commented, well, maybe it's just to every male. Maybe they just go through that pathway faster. So I don't know. I think that's something that we need to examine. But I know that females reported it, but we do know that females attempt more often, but males use more lethal means. And so I I do find it interesting, and that's something to think about within the farm family though, and uh trying to examine what are the differences. And that's where it goes back to looking at those coping scales, trying to see, is there something specific that stands out between males and females that make that percentage a little different, or looking at depression, anxiety in relation to that suicide risk. So I know that was a long answer for a short comment, so forgive me.
No, it's very interesting. And Kitty had a question. She had her hand up.
Oh, I was just gonna say the same thing that Andrea just said, that women attempt more often, but men use more lethal means, and therefore while the risk for women may be higher, the actual rates of quote unquote successful suicide is higher.
That's why when I present to a room and we look at that, I think what it was 2.5% of males. I'm still concerned about those 2.5% of males, because all it takes is that one decision with a lethal mean. And so I say, don't think that this percentage isn't concerning, because it is.
Do we have any more questions or comments? Well, if not, thank you to our presenters. This was such an interesting topic, but so relevant and timely for what everybody's going through nowadays. And so we really appreciate it. We look forward to seeing more of your stuff come out, since these were preliminary and pilot programs. So we look forward to seeing what comes out in the future. Thank you guys very much.